It's Jeff. I'm back.
I don't think it let me do it, Jeff.
Well, you're signed in as the host, right?
I don't know.
You should have a now I'm not looking at it, so I forget what it looks like. But when you're the host, you have like a play button. It looks like a VCR play button.
See, it never asked me to sign in. Do I have to go through the internet to do it?
Maybe.
Because like if I already had the app downloaded, so it already recognizes my name.
But did you do the thing? Yeah. Why don't you try that? Can you log in through the app? I'm sorry, through the web.
Yeah. Let me hang up and try it again.
Okay.
Well, it asked me if I wanted to host.
Okay. You said yes to hosting?
Yes.
Okay. So then you should have a play button, I think it looks like.
All I have is the video, the 4 people, and the hang up.
I don't think it's video. I think that the video camera uses your webcam.
Do I want to access the camera?
You can. Well, I'll see you.
Oh, no, don't need that. I just need you to see the screen.
I know. You don't have the share icon or anything like that?
I just have the attendees, and that's it.
Shit. Well, let me try. Well, I'm back. So you don't have the, like when you see, I think we're both on as the host now, but you don't have like a computer monitor with the 3 dots?
No.
That's really weird. Crap. Well, are you seeing my screen now?
I see your screen.
Let me try one more time to give you control. If that doesn't work. Let me try this. You must be OEC SASP.
Okay, now start sharing.
Yep. It looks like it's changing. I see your Google.
Okay.
Yeah. Okay. I see the docs. Nothing?
It's loading.
Oh, okay. Maybe it's... I've had this before. I wonder... I didn't bother to check and ask people what they were using, so I don't know. It might be an Apple issue.
I don't know, Van said that she used iPad and Google Slides. Can you,
Really?
can't see where it says midterm review now?
I
You
wonder if
cannot
it is.
see it?
Nope. I see Google Drive. All right. Well, let me take it back.
So you can see my drive, you just can't see when I
Yep.
click on it?
Oops. And actually, let me see if I can open it. Nobody's joined yet except for Barney, so.
Hi, Barney.
Can you hear me?
I can hear you.
Beautiful.
Let's see. I'm going to open it. I mean, I guess if everybody's going to count on watching the replay, we can run it with you, me, and Barney. You can help us review. Okay, let me, I'm asking for control back. You might have to agree.
Okay, nothing's come up on my screen.
Really?
Oh, there it goes.
Oh, okay. So now do you see mine?
Yes,
You see this one here?
I do.
That's the one I was talking about, but you don't have that?
Well, I did when you share. Oh no, I didn't have that exact one. It did not show a monitor. It had the very similar. It had a similar looking thing, but it didn't give me any options.
Huh. Well, shall we wait?
How many do you usually have sign in?
6 to 8. Let's see.
Oh, there's 100 questions.
Yep. Let me see if we started recording yet. Oh, yeah, we're recording. Well, seven.
Who is the 830 number?
That's Kurt.
What? Oh, okay. Hey, Kurt. So we have one person.
Yeah, I'm going to have a hard time signing on my computer. I went to reboot it, and now it wants to do this huge update. And so I think I'll sign on my iPad. I'm trying to figure out how to do that right now.
Yeah, I think the iPad app, it seems like it works pretty well if you're a participant, but if you're the presenter, it doesn't seem like it wants to cooperate.
I'll have to ask Van, but I think that she said that when she did it, she wasn't that you had control over it.
Yeah, I had to. We tried. I had to present and then run her slides for her.
And we didn't get a new session invite. We'll just use the last one, right? From the 14th.
Yep.
Okay, so they just give you one access and everyone uses the same one every week?
Yep, exactly.
Okay, gotcha.
I've noticed in the past others, tend to kind of come and go.
Yeah, see, it said it, free conference call. I have to get the app. Install.
So maybe what we'll do is as soon as Kurt's ready, I'll just hit play and you tell me when to go to the next slide.
Okay, it should be pretty obvious.
Okay.
If they know it or not.
Well, unfortunately, Kurt gets to be the guinea pig then.
Am I the only one?
Fortunately, maybe.
Well, I have had zero time to read. I tried to read a little bit last night, but I got a call. Unfortunately, I get to do maintenance at night. All right, for some reason. All right, we'll see if this on the iPad. Did you have to download an app to get on the free conference call?
You don't have to. You can go through the website or do the app.
Well, I tried to do it through the website, and it said it couldn't do it. It needed to go through. All right, let's see. What's the meeting ID?
The access code?
Online meeting ID.
OEC _ SASP
_ Let's see. Hey, I think I'm there. Let's see. Dial in using join without audio. Hey, I'm here. Wow, looks pretty good.
We see you.
All right. If I lose you guys, it's because my internet, for some reason, the last 2 days have been going up and down.
Uh-oh.
And I'm on a web call. It uses the Wi-Fi to make calls because we have such bad infrastructure services and packets.
Does that look good?
Yeah, I can see it.
Okay.
So, Kurt, can you see it?
Yes, I see it.
So pretty much the way it's set up is just questions, and then the next slide is the answer with the objective. So if you have a problem with a question, then I can give you the page number and it's going to show you the objective that it goes along with.
Oh boy, you're going to kill me.
Well, it's better than me reading questions to you.
This is true.
Well, and since we're one-on-one, we can skip anything that you're really familiar with, or we can cover in detail anything that we're not.
Yeah, I'll be asking a lot of questions. So the Alpine Patroller, what were the level of patrollers?
So the Alpine Patroller would be your on-the-hill patrollers.
Right. So you need toboggan skills. There's a written and a practical with the OEC. Well, you got to pass the OEC course. 3-month candidacy program on your mountain. I think you have to do all of those, don't you?
So it's asking you all of the following except.
Yeah, I know. Written and practical exam, I don't know.
Oh, you're gonna take a written test, aren't you?
Yeah, but that's for the OEC course, isn't it?
But
So if I complete
way,
the course, that already...
If you're Alpine or auxiliary, you'd still have to take the written and the practical.
Right. As part of the OEC course or on top of that?
On top of that.
Okay. Let's see. Well, I need to learn how to ski. I should be able to handle a toboggan. I guess D. I don't know.
You're correct. It's D.
D? Okay.
So, Jeff, if you just go to the next slide, then it's got the answer and then the objective.
Okay.
Okay.
If somebody wanted it. Okay, go to the next one.
The key to that one is that many hills have the apprenticeship program, but it's not an
right.
NSP requirement.
Oh, I gotcha. Okay.
So if you have your book with you, Kurt, this is on page 21, the difference between training and care.
Okay. Back injured cervical collar. Let's see.
Kurt, I think, started after we discussed this.
I think it's a standard of care.
You're correct.
Okay.
Okay. Do you know what the difference between standard of training and standard of care is?
Yeah, standard of care are sort of the practices that my mountain requires versus the training that I need to be proficient at the skills.
Okay.
Is that accurate?
Yeah.
Okay.
OEC, 5th edition, is our standard of training, and the local protocols, that's our standard of care. That's established by the doctor.
Right. Okay. I gotcha. Oh, I gotcha. Sure.
Go on.
The level of training emphasizes the provision of immediate. That's a emergency medical responder.
Yes, sir. Are you cheating? Do you have all my answers?
I don't have them. I'm a good guesser.
Hey, that might get you real far.
Okay, so the use of radio codes. Now we said we don't. We don't use numbers anymore. We use names, but codes. Decreased confusion is preferred. Yeah, I think it's discouraged.
Correct.
Not universal.
You'll hear them, but
yeah, some people.
The best strategy for wearing clothing in the winter is to wear layers. Oh, well, let me see. 3 layers referred as a base, middle, and outer. 4 layers. Oh, I go 3 layers. If I'm up in Canada, I'm probably 4 layers, but when I was in Vail, it was 4 layers. Minus 15 every day.
I tend to wear more than 3 also.
Yeah,
ahead,
I do 3 layers. I'm going C, Alec, 3 layers.
You are correct.
All right, I'm a good guesser so far. Wait till we get to parts of the body. I'll be struggling. Winter clothing is wool.
That is
actually
correct.
silk is pretty good too. If you got a little silk long underwear, that's pretty nice. But wool.
It is wool.
Which one of those
Wool?
The expression is cotton kills.
Yeah, if cotton gets wet, you're screwed.
Yep. Once cotton gets wet, it just continues to suck your heat out. So.
Yep. Oh, let's see. Prevent the spread of infections. Well, let's see.
I was about to say, I bet you can narrow it down to 2.
Yeah, well, OMC technicians can use to prevent spreading infection. Well, we want to wear gloves all the time. And disinfecting equipment. I mean, imagine after somebody's got something on somebody's face, you might want to clean it and disinfect it. Wearing gloves, washing hands. Let's go with that.
So if you had to choose on a test,
Wearing gloves.
Oh, I typed the wrong answer for that one. It's C. It's not B. It is C. Washing their hands.
I wonder if I can go back.
I got to fix that, or you might have control over it.
I can't do it on the fly. So it's C?
I'll make a note. Yeah, it's C. It's on page 79.
Wow.
And I made a note even on my paper that because it's all about wearing gloves and PPE and everything, but it goes back to even when you're wearing gloves, you should be washing your hands like before and afterwards, and after you touch different surfaces.
Yeah, I think that goes in restaurants as well. They require the hand washing is the biggest deal.
Well, so for that one, that might be one of those that if you were to get that question wrong, and you could come up to me after the exam and give me a really good explanation why B was a better answer than C, maybe we would throw that one out as a bad question. But,
because in the book, gloves comes before washing hands.
Yeah.
But then it goes. But under washing hands, it says that it has that little line in there that specifically says that it's the most effective way to prevent the spread of disease.
Yeah, this is Barney. You can go back to that question just for a minute, though. Remember, whenever you're taking a test like this, really read closely what the question is asking, and it says, is the single best technique. Okay, and so that's the key to answering that question.
Yeah.
But I'd also put in there washing your hands both before and after.
Yeah.
I'd still rather not get blood on my hands than wash my hands.
I concur, Doctor.
I agree. I agree with that, but there's other things. You don't have to have blood on your hands to spread infection.
That's true. And that's true. And I suppose so. I'm probably overthinking it. I'm thinking bloody patient and all that, but I suppose if you've got your typical patient that is just complaining of altitude sickness
and then
like
barfs
that,
on you.
Yeah. Well, the woman that I had a couple years ago, where I'm looking at her, I'm like, oh, we'll put a little O2 on you, and then just as she's getting ready to go, says, by the way, I have a severe salmonella infection. Would that matter? I'm like, oh no.
Chickenella salmonella, my favorite dish. Cross-contamination occurs when.
I've been touching you all over without gloves, and now, so I'm washing my hands crazy.
I would say you touch multiple patients, A.
Yep.
Correct.
I'm doing well. Hey, Kurt, are you keeping score?
Yes.
So
I missed one so far.
I have
1.5.
All right, so count it as 7 out of 8 so far. Or 7 correct. If you can evaluate yourself, then at the end we'll see how you did.
All right, sounds good. Evenly transferred to the legs.
Correct.
Not bad so far.
Okay, so you want to put her on the left side.
That is correct.
We studied that one last week.
Yep.
Or y'all brought it up.
See, now in my brain, Kurt, if there was 8 of you, you wouldn't have to be reading so fast while we're all sitting here waiting.
I know.
Okay, the greatest risk posed by an urgent move is.
Oh, can you see that when my news headlines pop up?
Yeah, it went away.
Oh no.
I would say C, delayed interventions for life-threatening conditions.
That is correct.
B, the femur, tibia, and fibula. You're going to get me on all these bone parts. I have no background at all.
I tried not to use ones that were like super out there.
Right. Let's see, the bones of the upper extremities of the body.
Well, think extremities.
Of the legs? Oh, of the legs. Okay, so you're...
hold on. It says upper extremities.
That'd be arms.
Okay.
All right, so the radius, the ulna, and the... That doesn't sound right. It's got to be, though, right? I'll go with that one. D.
Yeah.
Well,
Is that correct? The humerus is a...
So you know
It's
that
got
C is you know that C is wrong because which one makes C wrong?
Tibia?
Right. And in B, do you know what that second one is?
No, what is that?
So that's your heel. So what is
Okay.
A?
What's the radius? Is that your arm?
Yeah.
That's your pinky, the bone that's closest to your pinky on your forearm.
Okay, so is A right?
The radius
What's the humerus? Is that the humerus is your funny bone, right?
The humerus is your upper arm.
Well, that is an upper extremity, so we could go with A.
Yeah, so D is wrong because your parcel's in your foot.
Yeah, well, the body anatomy I know is one thing I got to stop and just actually memorize, but I'm not as good at memorizing anymore. Okay,
So
don't miss that one.
I had to read over a lot.
Okay, what's next?
Do the Millionaire game online and the anatomy chapter, and that'll help.
Oh, yeah? Okay.
Well, it helps me. I mean, I'm all about games. Oh, this one you got to think through.
So when you relax, you exhale.
Correct.
D.
D, yes.
D. You've said dog. You've said that enough times. So relax. Which of the following? Spinal column. Okay, so we're going to start lumbar, thoracic, coxal. I think it's coxal's last. I know that. Thoracic. Let's see, lumbar. Thoracic is your chest, right? Lumbar, sacral. Let's go with D.
Yes.
Is that backwards? Is that correct?
You're correct. That's D.
Oh, man, look at that. That was a good guess. I knew coxal was my tailbone. I knew 2 out of 4.
One wrong so far, right?
Well, no, I missed the upper bone one. So 2.
Oh.
We'll call it 2.
2 out of 15?
Let's see. Yeah, I've been dispatched. I could play. I would say D.
You're right.
I'm going to find out. Yeah, I'm going to find out if she's got trauma
so
or.
It's a part of your scene size up.
Right. Heart failure. When assessing the airway. I would say your normal respirations and see the chest rise or fall. A.
That's correct.
During primary, I'm going to assess the patient's ability to speak, or look for the rise and fall. But if it's a primary assessment, if I can get them to talk, I know that they're probably breathing okay.
So on that one, it's going for the whole lab.
Look for the rise and fall.
The look, listen, and feel. The look for evidence.
Right, because I mean, we kind of said if you walk up and the guy's talking to you, you kind of know he's breathing.
But on the flip.
I know why you were saying that too, and so that's not a great question because I would say, hey, look, if he can talk, he can obviously breathe.
Yeah. So, but rise and fall, I get it. I mean, if I come up to, you know, what would be a better one is instead if I came upon somebody that wasn't conscious.
Yeah, exactly.
Or then I'd look for the rise and fall. You put your ear down, listen. But okay, got it.
Yeah.
Well, I guess also though you could be speaking, but not be able to breathe very well.
Yeah, true.
Well, I could see it the other way around. It's like rise and fall would be the basic level, whereas speak, you could be breathing but not necessarily be able to speak. You can have a head injury and, you know.
True.
Yeah, it's not a great question.
I think in the medical world there's so much gray area.
Well, you understand the concept, so that's good. It's just, you know, that might be one that's poorly worded and hopefully you don't miss it, but you might.
Yeah, but I will remember that when it falls on the test. These are actual test questions, right, that y'all found?
These are. These are right out of the test bank.
Yeah. Hypoperfusion.
So that's just decreased blood flow.
Think about what the roots mean, hypo versus hyper.
Yeah, so hypo is not enough.
Mm-hmm.
And perfusion is what, breathing?
Blood.
Blood
flow?
perfusion, not enough. Oh, not enough blood flow.
So you're really on this one, you're kind of even, but once you get down to what it's actually talking about, you're really just looking at the question itself.
Well, I don't want to apply pressure to a depressed area of the skull. I'm pretty sure about that.
Good.
Checking the pupils with the pen light. I mean, if he's not hypoperfusion, painful stimuli, hypoperfusion, assessing the head.
So you've already marked out one. There's another one that you can completely get rid of because you would never do it.
Blind finger sweep to clear the airway.
Okay. So you've marked out C and D. So,
he's responsive. He's responsive to pain.
So this is your secondary assessment. It's an assessment.
Okay, I gotcha.
So which one of those that you have left is a part of an assessment?
Right. So I guess Pearl checked the pupils with the pen light.
Correct.
Okay. Yeah. Like so, cleaning. I mean, it doesn't say he has a laceration in the head, so I guess if he had one, I'd have to fix it. Assessment, but I need to assess first. Okay. I got to learn to think like a doctor. A chief complaint is the primary reason the person is seeking medical care.
Yes, sir.
Gosh, diaphoretic. I don't remember what that is. Diaphoretic.
Sweating.
Excessive sweating.
The pulse of 88, the blood pressure of 156 in his hand says that his pain feels like a heart attack 2 years ago. Based on this version, how would you document his chief complaint on the patient care report? Possible heart attack.
So do you think you would? It's
chest, chief complaint. Chest pain with chest pain with hypertension. I can't diagnose a heart attack.
Right.
Or my chest is hurting.
So if it's his chief complaint, would he say that he's having chest pain with hypertension?
No, he would say my chest is hurting.
That's the answer for that one.
Yeah, A. That makes sense.
It's one of those, like, taking the question apart things.
Yep. So we need to make sure they sign. Let's see. Make ssure the patient has someone who can write translation. Have the patient sign and date the refusal form.
Is that the most important? Is that the
most important? Well, ensure the patient understands the risk of refusing care.
Correct.
That would be the medical thing, but the legal thing would be having sign.
But was he completely goofy at the time when he signed it?
That's right.
We can have witnesses sign something that says we saw him do it, so we can still get that refusal from somebody else. You know.
I hope I get a whole bunch of these questions. Is there a not to switch subjects real quick, but is there a flashcard for the OEC online that you know of?
They're on mynspkit.com.
They're on what?
mynspkit.com. Have you received your book yet?
I have my book. I just haven't been able to sign up on NSP.
Oh, well, that shouldn't matter. There's a website that goes along with the book.
Oh, I see it. Yeah, register Brady Books. Got it. Okay, I'll do that tonight.
Okay. There's a lot of test prep stuff there and vocabulary, games.
Yep, this is Barney.
Okay.
Yep.
Yeah, there's also an app you can get for your smartphone called Quizlet. Quizlet.
What? One more time?
Quizlet.
Oh.
Quizlet.
Okay.
Okay.
You can get that for your cell or your smartphone, and then if you do a search on OEC, it will do it by chapter, and it will do flashcards as well.
Dang. Okay. 23 is B. We'll keep moving while we.
That's correct.
Beautiful. Should sound to maintain the patient's head. Oh, no tilting. Well, A is correct. Let's see.
That's correct.
Yeah. I'm trying to do it on myself, but it doesn't work. A is correct.
Yes.
Remove the non-breather and apply a simple mask. Yeah, but that may not help. She's freaking out. She's going to need oxygen, so the nasal cannula is not great, but if she doesn't like something on her face, you got to go that route, I think. I'll go with C.
That's correct.
Okay. See, I'm thinking like a doctor. I watched Dr. Strange last night, so I'm, feeling it. Oh gosh, not B. Not C. No, A.
Is that your final answer?
Yeah. I guess so. None of those sound good to me.
Oh.
Let me see what D was again. I activate the suction device only when I am withdrawing the suction catheter. Is that what we did? I thought we slid it down the side of the cheek and was sucking.
You insert it, but you start the suction as you're pulling it out.
Okay, I thought we stuck it down there and down the side of the cheek so that it wouldn't get down there. Okay, D. All right, let me write this down.
The only reason A is wrong is because a child is 5 to 10.
Oh, is it? Okay. Section.
So an adult is 10 to 15.
Okay, gotcha.
So it was kind of a trick question.
And C is definitely out.
All right, next.
Yeah, please don't pour water into his throat.
No. Ew, golly. Well, probably no more than 10 to 15 seconds, or no more than 30 for sure. But I go with B. I mean, you're going to want to keep going on CPR if you need to. You said the kids were 5 to 10?
Correct.
Okay. Let's see. There's 4 major categories of shock. Oh, man. Distributive, hypoxic, and destructive. No, distributive is one of them. So let me look for distributive. Well, I got 3 of them. Well, Burns not one of them.
Distributive is not one of them.
I think, no, I got, it is, you're right. I got obstructive, though. Was that obstructive, one of them? Damn.
Well, look at ones that just absolutely don't make sense. Like,
yeah, burn is no good.
Okay, so B is out.
Yeah, hypoglycemic is not one of them.
C is out.
Oh, hypovolemic, that's one of them. D has got to be it.
Correct.
You better got that right. We discussed that last Saturday.
We did, yeah. Hypovolemic. See, the things that you say over and over, I got those. Cardiogenic, obstructive. Well, remember we kept getting one of the subsets of those. Of one of them, I can't remember which one it was.
Distributive.
Was it distributive? Yeah, we kept getting a subset of it. I had to remember.
Everybody was guessing septic, but that's part of distributive. Septic.
That's right. Yeah.
Lactic.
All right. Slowed respiratory rate.
Is that your final answer?
I guess so. I probably got it wrong since you asked. Let me see what that is. No, I was going to say radial pulse of over 100 beats per minute. Yeah, I mean, the heart's, that's right. It's backwards. The heart's trying to keep up, and then your breathing increases trying to keep up.
Yeah,
I remember now.
Too, Kurt.
We did, yeah. The heart rate goes up, the breathing goes up to compensate, so that's compensative shock.
There you go.
Okay,
Yeah,
that's right. I remember now.
That's bad.
All right, I missed that one. That was a bad miss because I knew that one.
Yep.
Oxygen saturation?
Yes.
B. That's my final answer.
That is correct.
We need the
I feel like
music.
I feel like Slumdog Millionaire, by the way. You are treating a 42-year-old female including signs of shock. You don't suspect a spinal injury to try to heart. Well, you want her feet elevated. I'm going to say either A or... Oh, I'm sorry. Yeah, it was lower than the feet. I guess A.
It is correct.
I mean, both of them have... Why is C incorrect?
Well, because that's what they used to use, and it's become controversial because the organs press on the diaphragm and make it hard to breathe.
Oh, when you got the whole body slanted versus just the feet.
Correct.
That makes a lot of sense. Okay. That's registered in my head now.
As long as you can see it in your head now.
I got it in my head.
I wouldn't like my body to be tilted like that.
No, if you give me the explanation, and also the blood rushing to your head is not a good feeling.
Yeah.
Okay, the sun of a trim. Ischemic attack. Hell, I have no idea what that is, but maybe I can work my way through it here.
Well, if you have your book, turn to page 370, 371.
Okay. Hopefully when everyone listens to this, my questions are helpful to them. 371.
I'll give you a hint. The transient ischemic attack is also called a mini stroke.
Called a what?
A mini stroke.
A mini stroke, okay. Severe and permanent. I don't know. Are they permanent? Hang on, I got to turn the light on.
So if it's a mini stroke versus just a stroke, would you think that it's permanent or reversible?
No, probably not. No, it's reversible, I'm sure.
Okay, so if you read if you read the 4 answers and you keep that in mind, you should be able to kind of narrow it down.
Yeah, persist for a few days before they resolve. I mean, I think I've known someone with a mild one, and it did sort of seem to affect them for a bit. But I'm not sure how long. Okay.
Keep playing music.
Yeah.
So if you look at the last paragraph on page
24 hours.
71.
I looked it up. 24 hours. I'm going to
Yeah.
count this as a miss. I think that's my 4th miss. Let's see.
That's your phone, Barney?
Yes, he's playing the theme to.
Wasn't me. I was on.
All right, what's 33?
Up on mute.
An arm drift. See, these stroke ones, I don't know. Let's see. Hold your arms up over your head for 20 seconds. I don't know about that. Arm drift. Grab my fingers, hold hands, and squeeze as hard as you can. An arm drift would seem to indicate maybe you're putting your arms out, but I would think maybe grab your fingers with both hands and squeeze and see if you're getting equal, maybe. Does it affect one side more than the other when you're having a stroke?
So if you're thinking
I'll go
about your
B.
arm drifting, would your arm be able to drift if you were holding on to somebody's fingers?
No, that's what I said. It kind of sounds like it would be something like D, but
Yeah, you were right. It was D.
D, but I don't know if you want them doing this kind of stuff. Okay, so arm drift. I'm gonna write that down.
So that's on page
we'll count that in this
374.
5 already. Quit with the stroke stuff. I haven't
That's
got
on
that
page
far. I'm only like
374. That's all for chapter 11.
okay. I'm only like I've actually only been able to read through like chapter 5. I'm not finding time to read. I tried to read last night a little bit, but I kept getting maintenance calls. All right, 34. Dirty 4.
Is Jeff playing video games? Is that the noise?
It's got to be Jeff because it's his bird's tripping away there.
Yeah.
My birds aren't with me.
Which route of exposure, inhalation?
Correct. Breathing it in.
And 35.
I struggled with this one. I struggled finding the answer to it also, though.
Oh, I hate this question. This has been on the final. Really.
Let me see.
One of them you can automatically get rid of.
I'm going to say B.
If I'm right.
It is B.
I'll go with B.
It is.
What was it?
It is
B is in boy. Not that I know a lot about opiates.
So you got that one pretty quick there, Kurt.
Yeah.
I overdose usually because the coffee and suppresses them and forget to breathe.
Is that me losing y'all or?
I don't know. Jeff was cutting out. I didn't understand what he said.
Okay. I didn't know if that was me losing y'all or Jeff. Okay. So B was it?
B is correct. But Jeff has control of the screen, so I'm not sure if he...
I'm sorry.
Oh, you sounded like you were cutting out.
We're ready to move on.
Could be. Are you seeing slide 36?
He got 35.
I think.
Yeah, there you go, 36.
Oh,
There you go.
Is that better?
Yes.
Ooh, well, I know what this one is. I think the following criteria is not one of the criteria for administering activated charcoal. The hell is that? Which of the following criteria is not one of the criteria? The hell is activated charcoal? Clue me in.
Okay, so when you're reading the answers, what does it look like it might deal with?
Activated charcoal might be for inhalation poison or something. I have no idea.
So if you've ingested something like some sort of poison?
So do you eat the charcoal?
Yeah, so it
Absorb poison?
yeah, it reduces absorption.
Yeah, so less than 3 hours. Wait, is not a criteria. Oh, I'm sorry. Let's see. They have to be awake to do it. Transfer time be prolonged. Or some other EMS authority. Oh, it's like a double negative. Let's see. Which of the following criteria is not?
So think about like when you think about when you eat something or when you've ingested something. Like, if do you think that you would be able to wait 3 hours to do something about it?
No, I think A was the one I went toward because I probably there may not be any time limit on it.
Yeah, so it's supposed to be within 60 minutes. So that would be the answer because it's not one of the criteria.
Criteria. I know it's like a double negative.
Yeah, I know,
Don't
and they
do
have a
this
lot of
unless
those
you're
on
not
all
interested.
of the following except all of the following not.
Yeah.
It's A.
Let's choose the answer that's not correct.
Yeah.
I know.
I'm a teacher. I do that all the time.
Okay, here's another negative one, which is false about wheezing. It indicates constrictive of the lower airway. It is typically caused by asthma. It may be heard on inhalation, exhalation, or both. D.
So have you ever wheezed before, like you have pneumonia or something?
Yeah, probably. I mean, you can definitely hear it, so you don't need a stethoscope. Yeah, D.
So it's D as in dog.
Yes. I think that chronic bronchitis turned out it was a nasal passage pinch that was infected for about 5 years.
Oh my God.
And seriously, once I had the surgery to open it up, I mean, good from then on. A patient who is responsible only to pain control is covered with hives. He has respirations in a week. Guarded pulse is are on 50. As you would expect. Anaphylactic reaction.
Yes.
Yeah. Low blood pressure. I am going to insert a.
So is this person awake and talking?
They were awake and talking, yes.
So would that cause an issue if you did A?
Oh, that's right. They're going to be, they're going to gag. Well, wash the latex off the hand, obtain a heart rate, get a sample history.
So
I already
it
washed
says
the
that
latex off the hand.
Yeah.
I was gonna put that damn thing in her freaking nose.
Stop the absorption.
Yeah, let's wash the latex off. Okay. No, A is incorrect. Oh, let's see here. C is correct. So let's see, which one indicates that the speaker understands allergic reactions and anaphylaxis. So C is correct. So
That's correct.
yeah, we'll go with that one before I read D. A, breathing is easier.
Yep. Now, Jeff, I have a question about this one.
Okay.
I'm going to, let's see, the first thing I do is going to be radio for an ambulance.
So, Jeff or Barney, what would you say?
Let me see.
Definitely want to apply oxygen, but I think I need to get someone coming first. It's either going to be A or B. Or do you think he has nitroglycerin with him?
That's better than cool.
I guess he does since it has it.
Yeah, it certainly isn't C, because you'd have to have
Blood pressure?
you have to do the blood pressure before you do that, and even EMTs can't do that unless medical control. I think you're
So
probably
what would
right.
you guys have chosen?
And it's not D, because you do that in secondary.
Right.
Either A, D, probably B is, depending on how far away you are. But I suspect B and then A.
So the answer that they have in the test bank is A.
Apply
Right.
oxygen first.
In the book, on page 476 and 485, it's both pages. It says multiple times it states the need to call ALS immediately.
Yeah, because how long does it take if you have to, get your oxygen out and set it up?
True.
5-6 minutes, but making a call could be very quick. I need an ambulance right away. I don't know.
But again, calling for an ambulance, you'll probably you want to ask you where you are and all this other stuff too. You can
True.
be able to put oxygen on fairly quickly.
Okay, so we want to apply oxygen in this scenario.
In this scenario, for OEC standpoint, for nothing, no other reason to assist his breathing and make sure he's doing okay. I mean, that's
Yeah. Stabilize him first and then call for help.
right. Remember when we make our calls at the ski area, we do a primary assessment first and take care of any light threats as we can, and then make the call. I think that's probably the best way to answer that.
Oh, wow. Okay, so we did this one several times. That is where pericardial tamponade, what is it?
Tamponade.
Tamponade, is that what it was? We talked about this, and I don't remember exactly what it was, but she's got pressure in around her heart, right? Which is sort of like congestive heart failure, but I think it was called something different. Pericardial.
So I guess the one in this one, the jugular vein distension and the edema in her feet are what's supposed to clue you into the congestive heart failure.
Yeah, I thought there was another name for it. See? Yeah, I know she's got pressure on her heart or around the cavity. I know that's congestive heart failure, but I thought they were calling it something else. What is the pericardial tamponade?
That's when you're collecting fluid in the sac around the heart.
Okay. Is that not similar to congestive heart failure?
Well, congestive heart failure is just an inefficient pumping of the, I don't want to speak wrong, of the side of your heart that's drawing blood back from your tissues.
Okay, and so it's pumping. Oh, that's right. It's creating pressure, but it's not coming back out of the body, the neck. Right. Okay, gotcha. And I understand that one.
It's actually, Jeff, it's the right side of the right
Thank you.
ventricle, because it's not pumping sufficiently, so the blood is backing up. It's not going
right.
to the lungs, so it's backing up where it's coming into the heart. So it's coming into the right atrium from the body, from the vein. It's left-sided, then it's not blood going out through that, and you're not getting blood to the lungs to be perfused, and so you get pulmonary.
Is multipulmedema?
Pulmonary edema, because if it's left-sided, there's not enough blood coming back. The right side is pumping blood to the heart, to the lungs, but it's not coming back. If it's left-sided, it's not going out of the heart back into the body, so it's backing up into the lungs. If it's right-sided, then it's backing up into the legs from the rest of the body. That make sense?
Yes.
Are we on 44? Jeff, are you able to change it on your end?
Oh, I'm sorry. I thought I did change it.
Nope.
Better? Sorry. I thought you were reading. I guess I changed it and then changed it back.
Okay, so which is not an action you should take?
Don't you love when I do
So
that?
I'm looking for things that we want to do. So ensure no one is touching the patient when analyzing the patient's heart rhythm and when delivering shock. I think that's correct. Well, you shouldn't be doing heart compressions, but I don't know if touching them is a big deal when analyzing, but we'll go with that as a good one. Ensure the chest is dry and wiped clean of any medications. Okay, apply any set of electrodes if patient age is not relevant. Use the electrode to rip away excess hair if the electrode is not sticking. Well, you're supposed to use the smaller ones for the young children, but it says if you don't have them, you can use the big ones anyway, but I'll go with C.
That is correct.
Okay.
So the first one, when you were thinking about that one, that it doesn't matter when it's analyzing the patient's heart rhythm, if someone's touching the patient while the AED is trying to analyze the patient's heart rhythm, would that affect the AED?
I don't know if they said, I know you got to stop compressions, but I don't think they really specified that touching them would affect. I guess it could, but I don't remember them specifically saying you shouldn't touch them. I know they said you can't be doing compressions. Obviously, that's going to mess it up.
Or when it's delivering a shock?
When it's delivering a shock, you can't touch them at all. That will hurt somebody. That could be fun to watch, though.
They're great.
Let's see. Spleen, if it ruptures, loss of blood.
Correct. Did somebody else join our call? A 303 number?
Nick. Yeah, this is Nick.
Hi, Nick. I'm Liz.
Hey there.
Nick gets to answer the next 50 questions.
I was going to say, you're on 45, Kurt. Are we going to put somebody else on the spot?
Heck yeah.
You've done awesome, though.
Hey, Nick, can you see the screen?
My computer is like updating, so I'm downloading the app on my phone right now.
You know what? I had the same problem. Okay, I'll keep going until he's ready.
Maybe, Kurt, if you want to read it and then let Nick answer, or whichever one of you can answer first, just answer.
Sure. A patient involved in an altercation was struck in the ribs with the baseball bat. Your assessment reveals intact skin with significant bruising to the right lateral chest. When palpating this area, you note instability and cryptitis to the rib cage. An OEC technician would recognize A. Remind me what cryptitis is? Cryptitis?
Like bubble wrap.
So I can see it now, by the way.
Oh, okay, bubble wrap. So
Bubble wrap.
that means we've got...
It's a grinding sensation, like if you put sand in a machine. And
yeah, I remember that now. So
think more
chest
about
injury causing blunt trauma. Yeah, I think we've got a leak in there. So you have pulmonary injury caused by penetrating trauma. I'm going to say, well, but we didn't penetrate, but something
think
broke.
about what caused the injury.
Right, well, it was blunt trauma. Right? But she's probably got a broken rib that went into the lung. So would you actually have, is that called penetrating? But we didn't penetrate the skin. That's all internal.
Yeah.
Chest injury caused by blunt trauma. Yeah, B.
Yeah, right. Because if you go back up to the second sentence, it says intact skin.
Right. So, it's blunt trauma. But the penetrating happened inside, but it didn't penetrate the skin. Got it. This is very helpful.
That grinding sensation, that could be from the ribs that are dislocated, grinding on each other, or bone ends grinding together.
Yeah.
It's not necessarily So.
Grinding sound. Okay, a patient has a laceration on his arm from a table saw. Assessment reveals dark red blood flowing steadily from the wound. You would recognize this type of bleeding as, okay, so it's got oxygen, so it must be arterial.
No, isn't it venous?
Well,
oh, is venous from the...
Because arterial would be spurting.
Oh, that's true.
How about polar?
And since it was...
So which one are you going with?
I'm going with C.
Yeah, I think he's right. C.
Correct.
Flowing steady, not spurting. Right. Very good call. Let's see. All right. You're having a difficult time controlling bleeding from a small skin avulsion.
Definitely A. It's definitely A.
Patient's ankle, which is flying statements have been made. Yeah, A. I'll agree.
Very good.
I drank a lot of alcohol last night. It goes without saying. A's not it. The sheet placed from a container still sling in water, that's not it.
It's D.
D.
Which one?
Oh,
D.
D?
D is in Delta.
D is in Delta.
Oh dear.
I think it's
I
3
want
inches
to say
from the
A.
lower than E.
Which one are you going with?
I want to say A.
That's correct.
All right.
Oh, did you have a different idea, Kurt?
Well, I think C should be 3 inches from an elbow or knee, right?
Yeah, that's why
And,
I think C, and then I think
yeah,
B
and
is
B, there's a lot of
almost
places
any
you
body
can't
part.
use a tourniquet.
Yeah, you don't use it around somebody's torso. That'd be kind of...
No, but last resort, I was going to go with that one, but...
Which one were you going to go with? Oh, D?
Well, I knew A was right, but, yeah, tourniquet, last resort, I mean, you're doing everything you can not to, or you're doing everything you can, and then you got to go to the tourniquet. That's the last thing you can do.
True.
They're going to it more and more these days, so the new studies are showing
But
it's not.
Yeah, but it's still the last resort. There's nothing else to do after the tourniquet.
Direct pressure and then tourniquet if you have to.
Right. So, okay.
Whoa.
Hey.
Oh, it's kind of, that one was kind of long. Go up to 51's a little lengthy.
Your patient is a 10-year-old boy. He's exposed to dry chemical powder and is complaining about severe pain in the site of contact both hands. There is no...
Oh, dear.
Yeah, I think they say don't pour water on the dry chemical, right? That's what I thought I read. Brush the powder away.
But
I think it...
okay.
I think it's A.
Kurt, do you agree?
I do now.
You just have to rinse it for 15 minutes, right?
Yeah, I thought I read somewhere not to if you have a dry chemical, not to rinse it off, to brush it off. Did I read that in the book?
Yeah, I think you have to brush it first, but I think it's saying that after you brush it, then go ahead and rinse it for like 15 minutes.
Right.
Okay.
Yeah, brush it away first. Don't add the water to it.
Yep.
Right. Brush and rinse. Okay.
Make sure it's not a water-activated chemical, too.
Yeah. Sodium. Pure sodium.
Oh, God.
Oh, boy.
Okay, so dry gauze, no, never water, right? Never irrigate, never scrub.
Yeah, because water will ruin the tooth. You should put it in milk.
Yeah, does there milk one of the options here?
It either has to be D or A or B or C. But I think
Wait a minute, how many of those did you choose?
Well, B and C are pretty much like the same thing almost. But I think I think D is the right answer here because I don't know how to put somebody's tooth back in their socket.
Are you saying B is in Bravo or D is in Delta?
Delta.
So
Yeah, you never want to have Delta.
No,
Yeah, because you can't.
Read the second half of the question. Lies. It has to be B, as in Bravo. Yeah.
Yeah, we don't avoid touching the root. We will gently irrigate it. But didn't it say not to put the tooth in water?
I think it said not to like soak it in water if you were gonna keep it stored, like you couldn't put it back in their socket.
Yeah, if there's no chance that they're going to swallow it, obviously if you're on a bumpy road or, coming down the mountain or something, you wouldn't want to have it in their mouth. But if they're in a place where they could keep it like between their jaw and their cheek safely, then you could do that. So yeah, it's B as in Bravo.
So B as in Bravo. All right, got it.
I guess A?
Yeah, I think A would be.
It is. Bless you.
Oh, sure.
Big one.
Ooh.
Pneumothorax, was that,
It's a collapsed lung.
yeah, is that, that's going to be B.
You are correct.
Nice. Oh, boy. I like the music that's suddenly occurring here, huh?
Yes.
Who wants to be a millionaire?
So you want to definitely stop the lung from collapsing.
But, like, occlusive dressing, like, isn't an option here.
No, it isn't. But you
So
probably
you
need high flow.
Oh, man.
Well, you want it to burble out, so you don't cover the chest wound with a gloved hand. Place direct pressure over the abdominal wound. And then I guess you could work on, you're going to have to work one-handed then.
Shoot.
I guess think about which wound is more life-threatening.
Yeah, probably be bleeding.
Yeah, I'm going to go C.
Is that
That's what I would have to go with.
So the bleeding is going to be more life-threatening than the lung?
Well, I don't know. They're going to bleed out, but I mean, you want to put a, what do you call that? Occluded, or what do you call the dress?
Occlusive?
Occlusive dressing on, but that's not an option.
So until you get an
Unless I'm
occlusive...
mistaken, didn't it, like, it almost, like, hit his liver, so, like...
So while you're waiting for an occlusive dressing, what should you do to maintain oxygen?
High flow.
B. Oh.
Delta.
No, yeah, it is high flow O2.
Yeah.
Darn.
That's what
I go with Delta.
It's Delta.
That was a hard one.
That was a hard one.
It's almost like none of the answers are really right, honestly.
Yeah,
Well, because you're expecting to see the occlusive one, and then when you don't see that one, you automatically think, oh, well, I need to put pressure on the abdominal wound.
Yeah, I think that's just like a situation you'd be.
Yeah, the problem is if you put pressure with one, then you got to work one-handed everywhere else. So you're sort of stuck, you know. So yeah, getting the oxygen on first. Now you've bought yourself some time.
Oh crap. It's D.
We agree?
What'd you say, Nick?
It's D as in Delta.
It is D. Do you know what auscultate and palpate mean?
Not well enough to explain them off the top of my head right now.
Palpate is.
Palpate
was what you did to the lower.
So palpate is just feel. So that's like so it's look, listen, and feel. So when you're auscultate, you listen.
Auscultate, listen. Okay.
Yes.
Yep.
And then the palpate is where you feel for evidence that there was for that one. Yeah, breathing.
Okay.
Pelvic binder.
Oh,
Yes.
sorry, I'm not even looking. I'm writing notes.
Oh.
All right, back.
Oh, Nick, did you see that question?
Yeah, it was A, of course.
Okay.
I had the
C? As in Charlie?
I was just waiting for Kurt to finish reading.
Yeah, it's Charlie. Yeah,
Sorry.
Charlie.
Yep.
I go with it.
Sorry.
Yep.
Sorry, Kurt.
No worries.
He's already read through 50 of them before you got here.
Oh. No. Ooh. Is it D as in Delta?
It is.
All right.
I was not confident in that one. I'll tell you that much. I almost thought it was B, honestly.
Kurt, did you have a question about that one?
No, go back. I want to see that again. So it's only when, rewarming should only take place when there's no chance that the tissue will refreeze.
It makes sense.
Yeah.
Does that make sense?
Yeah.
Okay.
I mean, honestly, once it's frozen, I mean, it's already, the damage is done. So, yeah, I gotcha. Wow.
I guess C, Charlie's the best answer. It's the only appropriate.
Yeah.
Yeah, because some of the other ones are just...
Yeah, C is, you don't want to stop, and you certainly don't want
to. Yeah.
Yeah, it's C.
Hello?
Hello, this is Liz. Who is this? Who just joined? Hey, Jess?
Yep.
Who's the person that just joined, the 575 number?
I don't know.
They said hello, but now I can't hear them.
Really?
They might have just muted themselves and not know it.
It's Jamie Kroll.
Oh, hey, Jamie, it's Liz.
Hi there. Sorry for the interruption.
No, you're fine.
No.
Boy.
So this person is probably overheated.
Yes.
They're hot, dry skin, and you want to cool them down pretty quickly. I don't know, should the best method cold water? I'm not sure what the book said. I just know you want to cool them down quickly.
You both agree with that?
Yeah, I mean, I think that's true. I kind of don't know on this one. I think
what did you narrow?
So the best method is to put cold packs on the groin and armpits?
Yes.
Okay.
It's just a good Saturday night.
Coral snakes, right?
Coral snake, yep.
I always heard you're okay, Jack.
You've already heard. You heard what, Jeff?
Red on yellow, kill a fellow. Red on black, you're okay, Jack.
Oh.
The Jack, yeah. Was that Haste? What was Haste? So there's there's the pulmonary, and then there's the when the brain swells from lack of oxygen, which is probably what's going on here.
Cerebral.
Haste, that's what I thought. Yeah, should be.
Yep.
Final answer.
The build-up of nitrogen bubbles in the body is D.
I agree. See?
Yeah,
Susan Charlie?
He'd given C. Yeah, he'd given CPR.
Not dead till your woman dead.
Oh, okay.
Okay.
How do you guys think you did so far?
Okay.
I think you did pretty well. So, okay, now for the stuff that you'll be tested on, keep in mind it's just a practice test, so it's not going to be, not going to count for anything, but we're going to give you the complete test next week anyway.
Okay, cool. Oh, dear. You gotta go with.
Sounds like you're cooking a cat.
A's an offer.
Yeah, I'll go with A also.
All right.
Oh.
Oh dear. It's either A is an offer or D is in dead.
No, it's immediate care. Red.
Okay.
What are the colors? Do you know?
Red, yellow. Oh shit! What are the other ones? I just read this last night or 2 nights ago. Red, yellow. There's four, isn't there?
Yep.
Red, yellow. God. Green sounds right, but it's not right. Brown, is brown one of them?
Nope.
No, I can't remember. Black is.
And black is dead.
Black is dead. Yeah. Red, yellow, black. Wasn't there 4 of them? Red, yellow, black.
Red, yellow, green.
That was the other one. Is it green?
Or green, yellow,
Green is walking. Yellow is alert but can't wait.
Delayed.
Walking is green. If they can self walk or they can self evacuate, they're green.
And black is expectant, meaning expected to not make it.
Black is walk past them. It's minor injuries, but they don't need immediate care. I don't think there's a time limit on it.
Yeah, no, okay.
And they may not be able to walk. I think with yellow,
the green are walking wounded. So if they can walk away, they're called walking wounded. They're green.
It's not theory. Well, they may have a head injury, I guess. It doesn't exclusively mean that. I know that they have good command of the alert. Yeah, their vitals are good and alert, and they're yellow, but they can't extricate themselves. So it may not be minor injuries.
I think it's
I'll go with A.
A has to be the answer, yeah.
So, which one?
I'll go with A. I'm guessing none of them, A or B, but you're keeping us in suspense, aren't you?
Yeah, I was like,
yeah, I'm going with Alpha.
There we go.
Alpha. Hey, there you go.
Jeez. Hmm. 40 breaths per minute. I'm going to go with B as in Bravo. I don't know.
Red tag and move on. So, can I throw a quick question at you?
Yeah.
I think years and years ago, I took a first responder course, and they talked about doing a couple of quick rescue breaths on somebody and then moving on, because sometimes you can actually get the breathing restarted again. Is that not what they do anymore?
You reposition the airway. And
reposition.
Yep.
And 2 quick breaths and then move on, right? Tag them and move on.
I'm not even sure about the quick breath.
No, remember.
Okay. That's
just yet, but is 32 can do with the 3 questions? 30 respirations greater than 30. Remember, you're just doing triage. You're tagging and moving on because you're trying to get to the most people, the most benefit. There is one situation in which, and I don't know how you would do this, but there's one situation where you might want to do that, and that's if there were a lightning strike. You do reverse triage. You actually start CPR immediately because lightning strikes will interrupt the heart beating. So if you can do initial set of compressions, you might bring them back. But,
and then move on.
Hard to start. If you're doing the tagging, you spend no more than 10 seconds, 15 seconds evaluating the person, tag them, and move on.
Okay, gotcha. And hopefully someone's coming behind you.
August 5th, we're going to do it. So try to make it that early.
It's like a train wreck. It's like, where do you start? All right, train
wreck.
D is in Delta?
Ligaments connects 2 bones. No, that's a tendon. Oh, wait. What is what? All right, help me out now. Yeah, ligament connects 2 bones, right?
Yeah, it's either B or D.
Yeah, it's B. I think it connects two bones.
Okay.
It's B, you're right. Sorry, guys, my connection decided to die on me.
Oh, no worries.
Yeah, no worries.
Yeah, tendons connect muscle to bone, right? And ligaments are the big ones.
Okay.
I was confused those two.
Oh. Oh.
I'd probably go with D. I don't think we try to remove boots on the hill, do we?
Oops.
You're correct.
Right, D.
Did you say D?
I said D. I mean, maybe if you're gushing blood out of your boot, you might pull it off to try to stop the bleeding. I don't know. I'd just crank that sucker tighter.
Yeah, so the idea is if you're already in a traction, you don't want to take the traction off.
Right.
Right.
Yeah, if you want to take that boot off to do a traction splint, you're going to lose traction. And when you think about what that
you can make it worse.
Yeah, you're grinding bones into meat. And,
No, yeah, you don't ever want to take a boot off. I wouldn't think.
Mm-hmm.
I would never realign. I guess C would be the best option.
Kurt, you have a different answer?
I think C would be
Kurt.
where I would.
Nick, do you have a different answer?
No.
So
maybe splint the arm.
We're allowed to realign once, so you can make one attempt to realign because you're trying to restore CMS.
Yeah. God, I couldn't do that. I watched them do my son. Oh. Okay, so you would. So if that thing's all whacked out, you would try to put it straight.
Realign.
I don't know about that, man.
You're not necessarily
Jeff,
trying to put it. You're not necessarily trying to put it straight. You're just trying
to relieve pressure.
Restore the CMS at least before splinting it.
Yeah.
The key element to that question that would eliminate one of the answers is you always do a sling and swap together. You never do one or the other. They always go together.
You do what now?
You always apply a sling and a swap together.
Okay.
You never do a sling without a swap and vice versa.
Okay.
This one's definitely C.
It is definitely C.
Is that your final answer?
Lumbar and that lower.
It is.
Lumbar is the lower back, right?
Yep, you're right.
See, I only know that because I got a lumbar support in my truck.
Yep.
I have to remember. That's perfect.
Oh, dude.
C.
I'm going to go with D.
I'm sorry, D. Sorry, that's what I meant. Cervical collar.
Yep. Oh, no.
Go back?
So go back.
Is that because somebody else is maintaining the immobilization?
So yeah, it says that there's already manual inline spinal stabilization.
Oh, okay. I gotcha. Okay. Dang.
It's kind of
Ooh, that one was tricky.
Yeah, all right. That makes sense.
We'll go. Ooh. I feel like
So
this
think
is
about
like
it if it was your child.
It would be A then.
Yeah.
Yeah, you don't want to.
But if the caregiver's freaking out, isn't that the case where you might be like, hey, like, can you go in another room?
Distract.
Well, which one did you? Usually, I don't know. Usually they can get calmed down enough because they realize that they need to not freak out for their kid's sake.
Okay.
At least if it's a young kid. Sometimes we'll like step them to the side and tell them you need to calm down.
What you want to do?
Tranquilizers on.
You need to quit this so we can take care of your kid.
Yeah.
Bet you they love hearing that.
Jeff, does it say 76 on your end?
I'm stuck on 75.
Yeah, it's stuck on the answer.
There you go.
Now it's on 76.
Ah! Go back.
Oh, dear.
Oh, sorry.
Go back to 76. You get little happy fingers there, huh? I go with C. The nurture technician asks you why you should.
Okay then.
Let's see.
So we'll do pediatrics later on in July and go over some of their differences.
Yeah, so I think it was C. I didn't know this. The cartilage of the trachea is very soft and can compress if the neck is extended too far. That makes a lot of sense. I was going to say their mouths are so damn big. Okay, so cartilage is soft. Okay. All right, that makes sense. Right, wasn't it C?
It was C. You can go on to 77.
I would have missed it.
Yeah, I would have, let's be honest.
That's a lot of respirations. Let me see.
Oh, C should say allow, not mallow.
Oh.
Allow. Mallow.
I was doing this very late last night.
Gosh, I want to say D, but it doesn't.
Yeah, you need to give them oxygen. At that rate, they're probably not getting good air, oxygen in their lungs, right?
Okay, so what would be an easy way
really
to?
High.
What would be an easy way? Are you going to tape it to the kid's face?
No, C I think would be.
Yeah.
I think C would be the best answer.
Yeah.
It's C.
Okay. Yeah, I mean, 54 minutes is incredibly fast.
Not for an infant, not for a baby or an infant.
Really, that's like double what the normal rate is, right? Wasn't it 30?
And if it's an infant, it can be upwards to that many. If they're not breathing that fast. It's inadequate.
Yeah, it's too shallow of a breath. I don't know, grunting?
Of course, y'all haven't been over these yet, so don't fret about these.
Yeah, what? I have no idea.
I'm going to say D is in Delta. Say it's normal. It's probably wrong.
So it's actually B.
B?
Severe respiratory disease?
I don't know.
Huh. So that would be like, pneumonia or really severe distress. Okay. Not to be confused when an adult has that sort of grunting gasp. That would be when they're having like a heart attack or something.
A?
That is correct.
Oh, nice.
I think B is the easiest way.
B. Yeah.
Yes.
Bravo. Bravo.
I'm going to kill him now. On a streak. I would say B, as in boy. Or
Yeah.
Bravo.
Yeah, because it's not something you should expect.
Right, I agree. B.
Yeah, it's kind of messed up if you expect that.
Well, it's the normal way of thinking for a long time.
I would say C or D, but like D is kind of selfish, so we'd go C.
I would go with D.
Yeah.
Oh.
I wouldn't touch her. She's gonna sue you, dude.
Fair enough. Oh boy.
Holy cow.
Aren't they all? Jeez.
Full-term pregnancy, beginning her third trimester, but her water just broke. Well, that's going to be really premature. 40-year-old, but is that standard for
not at the beginning? Not at the beginning of the third trimester.
Yeah, that's pretty premature. 25-year-old, 220 days is how many months? 220 divide 30.
Isn't it going to be A? Because 39 weeks is pretty much 10 months or 9 months.
Right. It's 40 weeks is full term.
Yeah, so that's only a week off. That's probably more with twins. 8th month of pregnancy. I'll go with A.
Yeah.
Yep.
I don't know. Is it a warm zone?
You are correct.
Nice.
No, that was a total guess.
Good guess.
Well, B and C didn't sound right. Cold zone's probably when you're all finished with them.
Gonna go with C.
C. I'll go with Charlie also.
Yep.
That one was hard because B's like pretty close to.
So the last 15 go back to like primary assessment and mechanism of injury.
Mm-hmm.
Oh boy.
Let's do this.
You're in the home stretch.
People keep joining the call, but they're not speaking up.
Find out who they are.
Let's get them.
I'm gonna go with A's and alpha.
Yeah, I'm gonna go with A also.
Good.
Well, we want to check pulse. We want to check for bleeding. And the only two that does that is yeah, we're listening for.
Do you know what LOR
I'll
is?
go with. I don't remember. I remember reading about it.
Nick, do you remember what it is?
I do not.
So LOR is level of responsiveness. Does that help?
Okay, so we need to check pulse.
I think it's a primary assessment.
Right.
So think about where you might be for your first primary assessment.
I'm not going to stop and take a blood pressure on that primary. So A is out.
Is that the only one that'll knock out because of blood pressure?
C is out.
I mean, you would have to go with B because that's the only one that doesn't have blood pressure.
Yeah, B.
Correct.
Yeah, B makes sense because they check for any gross bleeding somewhere. I mean, you kind of do that quick feel, right, for circulation. I'll go with B.
Yeah,
is that correct?
It's B.
Okay.
It is B.
I'd go with A.
Yeah, you want to take it more than once.
Yeah, you're correct. Go ahead, Jeff. They got that one.
What?
They got that one.
Is it not advancing?
It's A. Oh, no, it did not advance on my end.
Oh, that's great. Let me go back. You seen T model?
Oh, Macros.
There you go.
There it goes.
Oh, a little delayed.
B. As in Bravo.
Let's see. DCAP model is all of the order in which to assess the patient during a physical exam. That'd be D, right? Delta?
Contusions, abrasions, and revulsions.
D?
Is it order or what to assess?
Well, it's deformities. You look for deformities.
So is it the what or the order? Are you saying Bravo or Delta?
No, it's just a what.
Oh, I'm sorry.
It's
Bravo,
it's
just a
right?
what.
Yeah, it's Bravo.
Yeah, Bravo, sorry.
Yep.
I'd say A is an alpha.
Yeah, A is an alpha.
Oh, no.
C. Go back.
Whoa.
Go back. Having an altered response to verbal. Oh, right.
Is that just like a more
the only
medical
thing
way
I
of
can
saying
figure
the
out,
same thing as A?
well, I reread the book, and the thing about, I guess the only reason it has to be C is because technically if you use the word alert, all answers are answered correctly.
Times 4.
Oh.
So if you're alert, then you're answering everything correctly. But if you're confused, then you can't be alert and confused.
Makes sense.
So that's why they went with C.
No, the reason why it's C is because he didn't talk to you when you entered the room. When questioned, he responds to his name. So he responded to verbal stimuli, but he was not alert.
Oh.
Okay.
Makes sense.
AFU is alert, verbal response. Alert is he responds spontaneously.
Yeah.
Well, he responds to verbal stimuli, which is what this says. So he's an altered response to verbal stimuli.
Gotcha.
Barney coming in clutch.
Thank you.
You're welcome.
A.
Yep.
Oh dear. They're all so similar.
Uh-oh.
It's A.
You are correct. Did we lose Kurt?
Uh-oh. You almost made it to the end.
I think we did lose Kurt. How unfortunate. It's P.
Correct.
R.
Yep.
There is no letter R.
I know, sorry. I want to say A.
Yep.
Bless you. Oh, B. As in Bravo.
Yes. Kurt, you're back.
I am. I've lost the internet. Now I can't get you back on my. Yeah, I'm telling you, the services here are just terrible in this town.
We can.
But I should be back.
Can you see it again? Oh,
Getting there. Join. All right, I'm almost there. How many did y'all get done?
For like
97,
2.
my goodness. Which of the following statements indicates that teaching mission understands the importance of evaluating the mechanisms, right? D. Delta.
Yep, I
Yes.
agree.
Yay.
Oh boy. D.
So look at what they have listed very last in D.
Yeah, primary assessment, airway management, immobilization, transport. I'll go with A, alpha.
Yeah.
But it doesn't deal with any bleeding. That's what gets me about it.
The answer?
Or is the bleeding encompassed inside the primary assessment?
So it would be taken care of in the ABCDs.
Okay. Yep, that makes sense. So then I would have to be.
Oh.
But.
Somebody just get punched?
No, my cat just ran into my table.
They just hit a tree while they were skiing.
That was the cat. Sorry.
B is in B for Bravo?
Yes.
Yeah, I'll agree with that.
Last one, guys.
Woo! This has been actually really good.
Yeah.
We'll do it twice a week.
I'm going to go with A rotation injury.
I think you're right.
Yeah.
Yeah. Dang.
Hey, really quick,
I'm glad we got to talk through some of this.
When I lost internet connection, there was one that I need to make sure has the right answer on it. Did y'all read the one about the natural gas explosion? And it said that there were 5. It's number 69, Jeff, if you can find it.
Yep.
I had originally inputted the wrong answer, and I changed it on my end, but I don't know if it changed on your screen.
This one?
No, it's number 69. It's not going to be slide 69. It'll be slide.
Oh, yeah.
Like 100 something.
138.
I have a couple of extra slides in there. Oh, you were so good. One more.
That one?
Yeah, that one. What's the answer that y'all had for that one?
I got it wrong, but I remember he got it right. It was.
I think it was place red tag and move on was what they. What?
Okay, good. It did fix it. I'm just checking.
Okay. I was going to say.
That's the right answer. Yeah, so Jeff, there's only that number 7 is wrong.
Question 7?
Yeah, question number 7.
Okay.
Hey, Jeff, is this on the Google Drive?
I will place it there.
Okay, cool. Since I missed half the question.
When we got into the stroke ones, that was the one that was killing me.
I bet.
Well, the good thing is, so hopefully this helps, and then we'll do the midterm, and it'll be a lot like this, just not jointly. And that should give you a pretty good idea of what you need to study for the real.
I think what helps is being able to talk through the answers and sort of like think like that doctor, you know.
Yep.
True.
That's what was helpful to me.
Guys, this is Barney. It's very important when you take a test like this. There's a couple of things you should be aware. Look for the word except, or you do everything but those type of questions. So you're looking for the false answer. The other thing is if you don't know the answer, usually your first impression is correct. So you say, I think it's A, but don't talk yourself into changing it unless you know for sure that something else. Okay? So,
True.
So if you don't know the answer, you say, I'm leaning towards A, and like A. You may be wrong, but the other thing is most of these tests, you can eliminate 2 of the answers right away. Okay? So eliminate those 2 questions, those answers, and then you're guessing at 50-50 and 5-5. So that's kind of the advice I kind of give you. The other advice I can give you is you do have all the questions in the test bank by chapter. So until you get the test, go through those test questions, in the test bank or by chapter, especially the chapters maybe you haven't done much with, and just kind of go through some of those real quickly and look for the answers in the book instead of trying to read the book and then go to the question. Because if you go to a question, you can look up the answer in that chapter, and it might give you some insights on how to study for that too as well.
Awesome. So we meet on Saturday at 10?
Yes.
Okay.
And it depends on how many people show up to do the practical midterm and how many instructors available and patients, but hopefully we can get through it pretty quick.
Well, I don't have to rush home, so I'm buying the first beer afterwards.
Question for you, Kurt.
Yes.
Are you going to bring one of those 32-inch flat screen TVs with you this time?
Yes, I'm hoping my brother-in-law has got. I'm flying my daughter to Abilene. We're going to pick up a new car for her. Believe it or not, Abilene has the best car prices in the state of Texas.
Oh,
so we're picking up. $3,000 less than anywhere else for many different models. I bought several cars in. Anyway, I'm going to drop her and a friend off, and I'm hoping that TV fits in the plane with me. Otherwise, I may have to bring it up next week. But yeah, I've been planning for it, and I'm hoping.
Okay.
When are you going through Abilene?
I'm sorry?
When are you going through Abilene? Because I'll be driving out Friday afternoon, and I go through Abilene.
Oh, really? I'm going to be there Friday morning. We're going to be at the VW dealership, and probably around lunch-ish or so.
Oh, this Saturday?
No, Friday. I'll think I can fit it in the plane. If I can get it through the back cargo hole, it'll fit. I mean, I can carry it. Weight's not an issue. So,
okay.
Yeah, if we can, it'd be great because then you can use your HDMI cable.
Yeah, Fred thinks there's a possibility of a connection problem, but I don't think so. I think it'll be very simple. So, but I'll bring extra connections just in case we can.
Okay, I've got some HDMI cables also.
Don't worry about it. Just bring the TV. We'll take care of the rest.
They charge you $35 for a cable at Walmart, but my brother-in-law buys them for 75 cents a piece because he buys them in bulk. He does TVs. It's crazy how much markup there is on these stupid things.
Oh,
and he gets the good ones.
Free because I have a few here that I'm not using at all. So
there you go. Okay.
Yeah, don't worry about it. Just get the TV. We'll worry about connecting up.
TV and a remote.
And a remote. Good.
All right, guys. We'll see you Saturday.
Okay. See you out there.
Hey, Jeff, I have a question for you.
Oh.
Yeah.
So if I had a friend who just came back from traveling for work and they want to do the ski patrol, would it be too late for them to try? I guess.
It's not too late to try. I mean, you can see it's kind of a challenge, and the later they get in, the harder it is. But
of course,
have them send me their contact info. And I'll get them, with Google Drive and all that stuff. And the other thing is, get me their email address as soon as possible, and I'll get them. Well, actually, no, they don't even need it. I mean, do that anyway, but have them go to YouTube and search for the YouTube channel. And,
yeah, that's what I was asking because I know they could catch up per se.
Yeah, just start watching the videos and They'll be behind on the practical stuff, but it's really this. We're kind of getting to the point where it would be really difficult to catch up, but I don't think it's too late yet.
No, yeah, I told them it's possible.
Yeah, everything so far is basics, but in a few more weeks, once we start getting into splinting and backboarding and all that stuff, then the practical skills, if you're behind, it's going to be real hard to catch up. So.
Mm-hmm. And then I can't remember the name, but of the person who's supposed to add us all on the NFC website, but did they ever do that?
Oh, that's Jeff Roberts. If you sign online, you should be. So just check in and see if you're able to log in with the information you set up. And if you did, see if you can register for the class.
Let's see here. I'm just looking right now just to see if I can at all.
What is that, Jeff?
When we searched on the OC website to find the patrol, do you remember what we put in to find it?
Just to find the patrol? I would try, or just Apache even.
Okay. Yeah, because I'm still not a member.
You're not coming up. I'll ping Jeff Roberts and ask him to. But you did register on the website and set up a username and password and all that.
Yeah.
Okay. I'll shoot him an email and ask him to double check everybody, and so.
Okay. Awesome. All right. Well, thanks a bunch. See you on Saturday.
Okay. Should be good.
Yep. Take care.
Okay. See ya.
All right.